1,000 people who've said, I am better, yeah? Which is 92% of the amount we started with. Now, because that's based on patient or client testimony, it counts for nothing in the medical world, and I understand that. But what we are saying to the ME Association and the Medical Research Council is, come and study us. You can do it. Do you know, we'll have no input into the outcome criteria or anything, just come and have a look at us. Because to be honest, until that happens, we have to remain a very expensive private treatment, because it's the only way we can maintain ourselves. Now, I'm sure one of you is going to ask why it's so expensive, so I'll just answer now. It is because there are huge running costs to keeping our organisation going. Practitioners have insurance, they have to pay supervision fees so that I can make sure with my supervisors that they're doing it properly. They have room costs, and they have ongoing clinical training costs. Now, we can't give them for nothing, or I'd need to go back to general practice, and I really don't want to do that. Although, I believe they make an awful lot more money than I do. Don't they? So, now I've lost track. What was it going? I'm only kidding, yeah. So, does that make sense so far? I'm aware I'm brushing over this, but I was told by Linda, who is the boss, I'll come to you in a minute, is that I was talk short. Because the room's so big, there's likely to be an awful lot of questions, and you'll probably learn more from the questions than me talking. Now, it was my 40th birthday on Tuesday, so we'll be leaving a little bit of time at the end for happy birthday, David. And there's no excuses. I spent it alone working all day.
Can I ask if the MRC or the ME Society or whatever it is are taking up your offer for
Good question. Is this a mic that works?
a trial? Are they taking up your offer for a trial?
If you ask it again so Auntie Jane can hear up the back.
Has the MRC or... Is that on? Yeah? Has the MRC or the various bodies involved in ME taken up your offer to do a trial that would...
No is the simple answer. What happened? I wrote to the MRC first, because that's sort of where you're supposed to... No, in fact, I wrote to the Department of Health first and told them of the exciting feedback we were getting from people we had treated. But there's such a lot of politics surrounding getting a trial set up, because you have to have an outcome study trial first, but you can't do it yourself because it will be biased. So we're kind of caught in a loop whereby unless someone from a professional body of research comes forward and says, we'll do it, then we can't do it. So it was kind of...
We couldn't pay them, this other body to...
Exactly. We're not allowed to finance any of it. It would need to come from... Yep. There are funds available which we're looking into getting, but they take an awful long time. But we're working on it. And, you know, after Martin's article in the Herald, we've had a lot more interest that might make it happen quickly.
Have you approached the ME Research UK regarding the same subject?
And not them directly. I went through Dr Shepherd.
Right. Is he a member of that?
Well, because he was the medical advisor to the ME Association.
Yeah, but ME Research UK is based in Perth. It's Dr Van Spence.
I have. Is that the merge group?
Yes.
Yeah.
Yeah, you have. So, no success.
Sorry, no.
It's just your background is that you're a GP, but what are the practitioners, the other practitioners? What is
Good
their
question.
obligations?
What we tend to do, and this might sound nuts, but we tend to try to train people with no background in psychotherapy or psychological treatments, except the consultant in Liverpool who works with kids, because he was able to forget what he'd been taught. Basically, most of our practitioners, and I do this through choice, is we train people who've been ill, recovered through the process, and fit the criteria that we need to become a practitioner. So I think 80% of them are ex-sufferers who recovered through doing Mickel therapy. So they're good people to see. They're here. and all over.
Anybody else?
This would be a first. Yep. In terms of what a session looks like,
just in terms of how you basically develop your treatment, how you work out what the trigger for that patient was, and how you develop the treatment from there on.
now do you mean when I developed it or how the practitioners do it now?
How you do it now, working with the actual patient.
What the practitioners are trained to understand is, first of all, that we believe, whether it's right or it is right, but there's the head intelligence that does produce emotions. Like if you sat and thought miserable thoughts, you wouldn't feel good. But we call them secondary. That's the power of the brain. So a lot of treatments are about affirmations or thinking positively. But unfortunately, because the body intelligence doesn't respond to that, it will stick to its guns and it sends negative emotions. So the first thing the practitioner does is they look briefly at where the symptoms began to try and get clues about literally what was the body unhappy about at that time. Now, 90% of the time there's little things that are built up to make the body unhappy. 10% of the time there's nothing. So there's not a lot of clues. What they are then trained to do is do what we call ease out the message, which it takes 2 days to train that, so I'm just going to give you the short version. Basically, we ask them in terms of what could your body have seen happening in your life at the time. Yeah, how did it feel about it? And a lot of the time clients say, well, I've no idea. But most people will be able to think, well, it might have been unhappy about that. The next step is for us to get the client to understand the effect of them not noticing the emotion that the body sent and how that affected the hypothalamus. So we just go into the past once. Then you have what we call the message. You go away, and every time the client gets symptoms increasing, hopefully most of them do, is that they apply the message, try to understand what the body is talking about right then. They keep a very short 1, 2, 3, 4 step notes, and then they come back, and the practitioner's trained to translate that into further useful information. After that, the next step is we move on to look at what we call the keys to health, which we apply to symptoms instead of the message. Now this, I always feel ridiculous saying this. 5 years I'd been doing this, and then one day I thought, well, wait a minute, why are we only 80% successful? What's happened to the other 20%? And as I was looking at it, I started to see that there was patterns that emerged in every single case about times where symptoms got worse. And literally there was only 3 things that people needed to do. Yeah? And this gave rise to the 3 keys to health. One of them, the key number 1 we use, is about really defining themselves energetically. Yeah, that sounds fin-torn, doesn't it? That means they have to recognise that if their body feels unfairly treated, it won't take it anymore. The second key, which is a facilitator, is about how they're able to express the feelings that are being created in that moment. Yeah? That's going to sound ludicrously simple, but I couldn't believe it. It's very effective. The third thing is the key of self. One of the things we're all taught is that it's wrong to put yourself before other people. Now, the body knows that there is a balance there that means self first, then others. So you fill your cup up, have a drink, then pass it round. Now, we're all mucking that up. When you start to correct it, the body sends less emotions linked to that. So what happens is they continue from session to session working with these tools and a few other ones that make it easier until they've unravelled everything that the body's sending in the way of symptoms and the emotions that are underneath them, and it stops sending symptoms. That's it in a nutshell. Now, the length of time that takes, we're always asked. We can usually tell how long it's going to take after 3 sessions, but the thing you've got to understand is we don't fit into any previous category of treatment. We don't heal people. We show them how to make themselves well. So if a person's life is tricky or got more things going on in it than another's,